or if this was an injury, a car accident, all these types of things. We can store emotions in different areas of the physical body, and those emotions can come out when we put a needle in that area. All right, so in this video, I'm going to talk about some fascial hydrodissection techniques that I've been utilizing a lot more lately. They're having some really interesting results, and I want to talk about them and start talking about them more. So we've done a lot of fascial plane hydrodissection for chronic pain in the past. And so what that means is there are layers between certain muscles, between the bone and muscles. Sometimes it's between the skin and the subcutaneous tissue, or even the subcutaneous tissue and the deeper muscle layer. But there are these fascial layers, or these fascial planes, where you have two layers of fascia, and it's usually a potential space in between. What that means as a potential space is that this is not a space where we can actively see things. It's a very, very small space that is present, but it does not become truly visible unless we actually put some fluid inside of it and do what's called a fascial plane hydrodissection. Now, in the regional anesthesia world, they've been doing fascial plane blocks for quite some time. Used to be a lot done with palpation guided and different pop techniques as you pierce through fascia. Now, a lot more ultrasound guided. And so we've kind of adopted this approach that used to be just with the regional anesthesiologists doing these fascial plane blocks. And we've been using our orthobiologics, our dextrose, we've been using Quinton, very low concentration steroids at times that are not suppressing inflammation. I'm talking like 1/1000th of a normal dose of steroid. And we're putting this fluid inside the fascial planes where we think there's some dysfunction in movement patterns, in the myofascial chains, where there might be pain, all these types of things. And we've been seeing some really, really fascinating results. One of the more recent, probably within the past 6 months that we've been doing a bit more, is we've been using these fascial plane hydrodissections as a way to help people kind of let out or address or resolve or express, maybe is a better way to put it, some emotions that they have attached in certain areas. Now, one of the things that we see relatively common is when we put a needle in an area where, somebody might have a little bit of a traumatic experience. So whether it was a surgery that was a really hard recovery, or a surgery where, just the person didn't want the surgery and ended up having the surgery for whatever circumstances, or if this was an injury, a car accident, all these types of things, we can store emotions in different areas of the physical body. And those emotions can come out when we put a needle in that area. The very first time this ever happened with a patient of mine, I was still a medical student. We were doing some cervical injections, and the patient had a very, very strong emotional response because that area had just caused her problems for so long, and there were some deeper emotions attached to that. And so we have a patient right now that we've been working with, did the third treatment, where we're just treating fascial planes and some scars from some surgeries. And each time we do this, there is a huge release of emotions that comes with these injections. And personally, I think, and the patient also agrees, that a part of this is actually therapeutic. Having this needle in there to be able to help bring awareness to that spot in the right person can be a trigger to help release some of those emotions. Now, one of the things we're hopefully going to be exploring in the near future is having somebody in the room present to help guide through these types of procedures, in terms of being able to guide people through the emotions, the thought processes, and being able to work through those actively while they're undergoing a procedure with us. The really nice thing is that these procedures are relatively painless because fascial plane hydrodissections are not major inflammatory injections. We're not injecting into joints. We're not injecting into tendons, ligaments, things like that. And so because of that, there is less pain associated with the procedure. So these procedures are relatively, painless, or very, very minimal pain associated with them, which is also nice because it kind of gives space for that person to be able to internally recognize those emotions and be able to try to work through those. Now, one of the things that we've noticed is that a person has to really be open and in tune with that side of their body in order to see these types of emotional releases. So some people might have an emotion in an area, and if they have never explored that before, that might not actually bubble to the surface. What might bubble to the surface is a danger signal. The body might not interpret grief. It might interpret pain, or it might not interpret sadness. It might interpret pain. And that's predominantly can be a protective mechanism by the body, because in a way, our bodies are trying to protect us from those deeper emotions, because those things can be scary and can be difficult to address. And so we have to have the right person, I think, in order for these types of approaches to work. I don't think we can just start doing fascial hydrodissections on everybody and start to see these emotional releases and things like that. And to be quite honest, not everybody has these emotional connections with their injuries, or there's these deeper seated emotions that are trapped in the fascia, in the musculoskeletal tissue. And so we have to have somebody who already has some form of awareness that there is some form of emotions in a particular area. And these people are generally going to be more in tune with their body. And I think that's probably a good candidate for these types of procedures, where we're going to not necessarily treat based off of, oh, this is what your imaging says and my physical exam says you got pain here, but more so from an energetic stance on where do we feel that there's a stagnation of emotions, or the stagnation of the tissues in a particular area, that there might be some trapped emotions that we can try to help liberate with our fascial plane hydrodissections. This is probably one of the first times I think I'm really talking about this. And so please leave a comment. I'd love to hear your thoughts. If you have any experiences, whether it's with body work or injections or anything in terms of, these emotional releases or anything like that, I'm really interested to explore this a bit more, because this could be a fantastic way for us to have a less invasive procedure to help bring out healing in a way that's different than our traditional orthobiologic injections of tendons, ligaments, and musculoskeletal tissue. Maybe we can start using our needle to bring awareness to a particular area of the body and use fluid to open up that space, which might just give somebody the space to actually start to address some of those emotions, which that in and of itself could be the catalyst for healing. All right, let me know your thoughts, and we'll talk soon. See ya.